Well, hello guys, Dr. Syl here, and welcome to another video. I realized I haven't done an intern diaries for a while, I guess because I'm a resident now, and need to do a little bit of reflecting. So I was thinking in this video we could talk a little bit about how my neurology term went, which was my first term as a resident, and we can also talk about what it's been like to work with interns. Which I used to be just a few months ago. And I wanted to talk about this kind of existential point that so many doctors get to, that I'm at now, this fork in the roads where I kind of have to start choosing which specialty to, like what pathway in medicine I want to complete. Do I want to go into GP, into psychiatry, into ED, into whatever? Like that decision point is coming up pretty quick, within a year, I guess. And I'm here in Merimbula, which is a beautiful part of Australia, and I'll play some B-roll while I talk so that it's not too boring. And it's gotten me in a very reflective mood. I've really been spending a lot of time just kind of, I guess, fantasizing and thinking about what the future could look like and the different, like if I go down different pathways and choices. And I think I've come to a pretty good decision so far, and I'll tell you all about that. This is a different style of video. I'm very far from the camera, which I don't like. I much prefer it when the camera is close to me. I feel like I'm talking to someone else. But I just thought this is just a beautiful kind of piece of infrastructure that my mum and her husband built. And he's just got such a aesthetic eye for detail and has built it very thoughtfully. And I just thought I'd come down here and chat, and wanted a bigger angle to kind of capture that. As a quick life update where I'm up to now, I've finished my neurology term, and now I have started my forensic psychiatry term. I've just done 1 week of forensic psychiatry. It was a little bit bumpy because forensic systems are very high security, and so it takes a little bit of time to get the kind of security clearances needed to move around freely. So currently I still don't have like keys that let me move around the hospital independently. I still have to piggyback with other people. But the cool thing is that I only realized a couple months, like maybe 2 months ago, that in residency you get paid study leave. So that means you get 1 week paid to go and study whatever you want, as long as it's approved by the admin. So the second I heard that, I looked up at all the stuff that I could do with like 1 week courses, and there was this cool ultrasound course in Queensland, which is like north east in Australia. And so I'm going to the Gold Coast in a couple of days to start a 1 week kind of ultrasound course. It's really focused on ultrasound and emergency medicine, an introduction. And so it's all the kind of point of care ultrasound techniques to diagnose life-threatening things. So I'm very excited for that. It's going to be very useful to know that. And so if I do become an ED physician, that would be very useful. And I'll tell you a little bit about what I end up choosing with my life, or what I think I'm going to end up choosing for my life later on. So that's where I'm up to. And so just before that trip, I decided to come and see my family. It's Mother's Day tomorrow, so I've come to Merimbula to say hi to everyone, get a bit more vitamin family in, because it's been a while. Now, I think I won't see them for a while after this, because I'm going to be going to Europe in July. That'll be my next big trip. And there I will go and see my extended family in France, and that will be so good. I don't know if you can hear the beautiful sounds, by the way. There's the sound of the trees and the wind and the birds chirping is beautiful, but I don't know if this microphone captures kind of ambient sound very well. It probably doesn't. So I'm feeling really happy right now. Just sorry, I'm still going on with the life update. In life at the moment, I'm feeling very happy, even though the points, like I was just saying, I was kind of existential, but overall, like, I've got a wonderful girlfriend who I love with all my heart, and I can't wait to live life with her. We're just a really good team, and I've got like good options for career paths. Yes, I'm existential as to which path to take, but first world problems. And just kind of enjoying being in nature a little bit in Merimbula by the water. There's nice beaches here. I uploaded a bunch of photos to my Instagram, so if you want to check that out, you can go do that and you can see some of my photography skills. I'm not that good, but it's such a beautiful place that you don't need to be a good photographer for it to look beautiful. So let's talk a little bit about neurology as my first residency term. It was an interesting situation in neurology when I did it. There was extra funding for an extra JMO, an extra like doctor to be on the team, because last year it was so busy. But this time it was, I don't know what it was. There was just people. I mean, I'm just going to be transparent. I felt like it was not a busy term. I rarely did overtime. There was often afternoons where I had 1 to 2 hours free, and I wasn't busy. And I was warned that it would be a crazy busy term. So that was a bit weird. It's a great term though. Like, it's really interesting. Neurology is like a fascinating area of medicine to geek out to. You just the presentations, the clinical signs. I mean, there was times where like the consultants would pick up things and it was straight out of house. You know, the way that they would pick up, like they looked under the shoes to see like if it was worn, and that would give them hints about the gait. And gait is like how people walk, G-A-I-T, gait. It would give them hints about their gait, and then they would do all this examination stuff and find all these reflexes and clinical signs that would guide them down a path that you could just see they were miles ahead. Like, I just felt they were miles ahead of me clinically, and I would never become that clinically astute. Like, they were pros. And it was awesome to see people geek out over these like fascinating disorders and sometimes fix them and sometimes not. Like, neurology is kind of like a lot of things don't have great solutions. And like, I guess with strokes, there's a lot of rehab involved, so people get better but very slowly. So that it was kind of nice to see people get a bit better, but we weren't the rehab unit, we were just a stroke unit. So in terms of what it's like as an intern or a resident in neurology, you take turns at being on call. When you're on call, you go to the stroke calls, and as the junior, you usually just ordering all the investigations, point of care when someone comes in with a stroke, and documenting what the NIS is, which is the scoring system that people use to assess the severity of a stroke. It involves, basically it's a neurological exam, and every time they have a deficit, it adds a point. And it guides the management, and the main things that they do are they might thrombolize a stroke, which is they put some TPA, or some tissue plasminogen activator or something, TPA, into a vein, and that's like a clot buster, but it has risks of bleeding, so it's not without risk. And usually they make that decision with the patient, and it has to usually be if the patients come pretty quickly after getting symptoms or signs of a stroke. So if they're within 4 hours or sometimes 8 hours. And there's a couple of other parameters to help make the decision as to whether to give TPA. But that was really impressive when they used the clot buster, TPA, because when someone comes in, they're hemiplegic, they've got facial droop, they can't move their limbs, they're like slipping off to one side, they can't feel anything. Like, when they have catastrophic strokes, the next day, if you give them some TPA, they can regain a lot of function overnight just by getting this drug. So it's one of those kind of almost miracle drugs. I shouldn't romanticize it too much, because there are risks of bleeding and things getting worse. And the other big thing that's relatively new in neurology when you get strokes is clot retrieval. Now, our hospital doesn't do clot retrieval, so all we would do is send them to the centre that does clot retrieval, so it's not that exciting. But you would see people like go from seriously unwell and like very significant symptom burden to being much better. And that was pretty impressive. And yeah, it just amazes me how lucky we are to live in a healthcare system that can coordinate and give such high quality care to people. It's cool to see lots of seizures, saw some interesting myasthenia gravis cases, uh, um, and what else was interesting? And then there was a bunch of weird and wonderful things. I got to do a lumbar puncture, but I got it first go, which was great, and it was called a champagne tap because there was no blood in it. So if you do a lumbar puncture, I don't know if you know what that is, that's when you basically put a needle into the spinal canal where the spinal cord is, but you do it below where the spinal cord ends. And so you have to go along certain ligaments between vertebra. And so I did it with an awesome instructor, I guess, and she was just kind of guiding me through it. And yeah, I mean, that one was easy-ish. I didn't like hit bone or anything. But sometimes they can get really hard, especially if like tendons calcify or if people have scoliosis or they have hardware and things. So you have to, yeah, they can be a pretty tricky procedure, but pretty safe. So all in all, a good term to see interesting cases and to do interesting procedures. It was great to work with interns. It was nice. I had there were some pretty impressive interns on the team, and it was cool to see how far I've come, I guess. Like it's a year later and you just see like how scared and interns are. But the ones I worked with, they switched on really quick. It was pretty impressive, and it was good to start like learning how to manage people. It's the first time medically or clinically that I've had people that I have to work with. And I don't think I did a great job. Well, I don't think I did a bad job either. I think I have a pretty playful, high energy style, which means that you can kind of, be honest and transparent and tell me what you're thinking, which is good. I'm very approachable, but maybe sometimes I'm a little intense. Yeah, I don't know. I should talk to them and get some feedback, actually. It's been really nice being a resident because I know how to do 90% of the jobs now that I have to do. And so I can be as busy as I used to be, but I'm way more calm now with the workloads because I know the processes on how to do the different jobs. And that's a really nice feeling, especially with after hours shifts. Like I know what's important and needs my attention, and I know what's not important and can be deprioritized. And yes, a lot of people can get grumpy that like I'm not doing the things that they want me to do. But one thing that's really important to remember in hospitals is like you're the only one who knows your order of priorities, and the role of other people is to advocate that their job is high priority, but you're the one to make that final assessment. But yeah, I've been enjoying after hours shifts. Well, it's starting to get dark, so I better bloody hurry this up. So neurology, great term, and I don't think I want to be a neurologist. And it was good because it was the first time I've seen a term and been like, medically, and been like, oh, this is not me. Just hearing the way the consultants speak about the minutiae, like these random tests that are 10 acronyms long, that's not kind of I don't know, it was, it's not always something you can put into words, but I didn't feel like when I saw what the consultants were doing, that's what I want to be doing in 10 years. Like that's not the feeling that I got. Whereas in ED, when I see the consultants, I'm like, I'd love to be able to do that in 10 years. But that's actually a good tangent into talking about this path, this kind of fork in the road. Quick plug, I've started a podcast called the Doctors Getting Coffee podcast. It involves me chatting to doctors about their personal and professional lives, the decisions they made along their career, why they made them, what they regret, what they're proud of. And it basically gives people an opportunity to sit down with doctors who are too busy to usually sit down and grab coffees and hear their points of views. It's a beautiful thing. I hope you have time to check it out. The fork in the road that I'm talking about is deciding what specialty to do, and it really comes up in Australia when you're a resident, so PGY2. If you're American, usually you choose, my understanding is, straight out of med school. So med school, I feel like the students are more involved in the teams when they do their rotations, and then they make their, oh, there's a fish or something. All right, if a giant sea monster eats me, just make for good views. Yeah, in America, the students there, they're more involved in the teams than I think Australian students are. And so when they finish med school, they're probably better equipped to make that life-changing decision. and then they match and go down those pathways. But I don't know, like it's impossible to make the perfect choice, and there is no such thing as a perfect job. But I don't think I would be ready to choose a life-defining pathway just out of med school in Australia, at least. So for Australians, it's really after residency that you have, or during residency, PGY2, so postgraduate year 2, that you have to make these decisions. Or you can choose to do an extra general year, which is, by the way, what I might do. So last year, and with this channel, you'll realize that I was really interested in psychiatry and mental health, and that's what I wanted to do, psychiatry and mental health. And then I did my ED term, and I was like, this is sick. I mean, I enjoyed it, and if you enjoy ED, that's pretty rare. And I liked like the resusces, I liked the pace, I liked solving problems, I liked being in the front lines and getting crap done. It was jumpy, and then you could switch off when you left, and that was cool. But now I've restarted another psychiatry term, and I like it again. I'm doing forensic psychiatry, and I'll do a big video about forensic psychiatry at the end of the term, but it's fascinating. It's really vulnerable people. It's really fascinating psychopathology. It's very holistic, understanding every element of someone's life. And it's a really big problem. Mental health in general is a huge societal problem, which it's a big problem without good solutions. So it will be good to be a part of it so that you can be a part of the next 100 years where better solutions will come up. So there's a lot of positives to psychiatry. Also, you're not getting burnt out as much. Like I've seen the jobs of psychiatrists, and it's like very, I don't know, it's less intense than ED in my opinion. As a junior, seeing what they do. I hope that didn't offend anyone. It's just from my observations, and I'm wrong about a lot of things that I think is true. So maybe I'll eat my words one day. Man, the light is going, and there's a beautiful moon. I better finish this video up quick. I talk too much, but for the few of you that enjoy me talking, I'm going to keep doing these videos because it makes me reflective. So, what's my solution to this dichotomy that I face? Should I go down this calm, chilled, well, I shouldn't say chilled, but this kind of lower intensity, low intensity, very important global problem or national problem with not enough psychiatrists in it, so I would be needed and add value to it, and easy to get jobs, and probably better paying, to be honest, which is a kind of factor for me. Like it's definitely a moderate level importance factor because I like buying things. You know, I'm human, although I try and be minimalist. There it is, I like buying things. Guilty. Or do I go down this other path of like higher risk of burnout, tough hours, doing nights much longer than you do nights in psych, funner, I reckon, like getting into it, cool vibes, and also not needing more doctors in the most senior positions. So that's based on a bunch of reports that I've read that say that there's an oversupply of senior ED clinicians, so it's harder to get these jobs. So I wouldn't be as needed. So these are the two kind of pathways that I'm facing. I don't think I want to do GP because I like, well, I don't know, maybe I will, but at this point I don't think so. So which one do? I think I do both. I think I was just chilling by the ocean today, just watching the waves, listening to the waves. There was dolphins, by the way, so beautiful. Anyway, and I just kind of thought, 3 days a week psychiatry, 1 day a week ED, 1 day a week podcasts and YouTube. That's an awesome week. I would have a great week on weeks like that. So, and you can, and psychiatry is relatively part-time friendly. Things happen slowly in psychiatry, just like in most primary care. And that might be what I end up doing. And psychiatry training, oh, there's fishies. And psychiatry training would be hard, but it would be interesting. And I think it also works well with YouTube because it's such an interesting new developing field. So I think that's what I might do today. That's what I think I'm going to do for the rest of my life. But to help facilitate such a difficult decision, I'm going to do probably a locum year next year. And sorry, the other part of that decision is the fact that I'll do ED once a week, which I think will be enough for me. And I think I'll still get the sense that I'm helping the chaos of an emergency department, and I find that to be a good thing to do. I think I'll get that sense, but I won't have the risk of burnout, because I don't want to get burnt out. And it really upsets me when I see people like who are incredible people and they're just burnt out and hate their jobs. And I don't want to be in that position. I want to design my life better. Oh yes, next year I'm going to do a locum year where I do psychiatry jobs, ED jobs, maybe a couple of like cardiology or other medical terms that I never completed jobs, and maybe some pediatric jobs as well. And that'll help me kind of finalize that decision. That's the current plan. The other good thing about locuming is that I can go around Australia, which means I can like interview different people, go to different hospitals, and do a tour of Australia. Like that sounds bloody awesome. It's kind of it's like a gap year, but paid. Anyway, it's very dark now, so let's call it there. Thanks for staying till now. I hope you guys enjoyed this video. If you want to support me, guys, jump on the Discord and let's chat. Follow me on Instagram. Buy me a coffee at buymeacoffee.com if you like. That helps with the podcast. You can support the channel by becoming a Patreon and or a YouTube member. And if you do that, you get special perks like access to the full Doctors Getting Coffee video podcasts. But you can still get the full podcast as anyone. Just go to your favorite podcast app. Anyway, that is it for this video. I wish you all an absolutely lovely night, and I'll see you in the next one. Bye for now.